You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today is an extreme makeover edition with minimally invasive techniques. You can look years younger. My advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of minimally invasive facial rejuvenation. My first guest actually needs no introduction. She's San Diego's probably most well-known and hottest dermatologist, Dr. Tess Mauricio. Dr. Mauricio, welcome to the program.
Thank you, Randy.
And you live up to your introduction, by the way. You look 15 years at least younger than your age.
Thank you, Randy. Well, you know, whenever people tell me, because they watch me on TV, and then their first thing whenever they see me in consultation in the clinic is, my God, you look so much younger than even on TV. And I always tell them, thank you to technology. It really is. I'm a walking advertisement.
Well, you're one of the few people that could pull off a real tight shot. I mean, because it's almost like you have no pores on your face. I'm trying not to endorse you too much, by the way,
the thing is,
it's true.
I never wear this much makeup, truthfully. I mean, when patients see me in clinic, I do not wear any makeup. Maybe a little bit of eye makeup, a little bit of lipstick, and I invite patients to take a look and see, because that is what technology can achieve now. And I was not born with great skin. It's just
it's hard to believe.
Yes, it's hard for me to believe that we can achieve this kind of amazing skin now. And it's not just available for me because I own the machine, or celebrities in Hollywood. It's available for everyone.
You say that, you were telling me off camera, you say that just about every celebrity is doing this kind of stuff. You just don't.
You know, take a look at even Oprah before 10 years ago. She looks better now. There's so many celebrities out there that you're wondering, how come they're not aging?
Yeah.
I mean, it's not natural for us, for all of us, to not age. We're continuing to age, but the difference now is that we have technology to truly reverse aging. We no longer have to go under the knife. We no longer have to go and have invasive, painful surgery and risk looking unnatural. We can keep ourselves looking young, looking great, feeling great, and without downtime.
Are you convinced, by the way? You know, okay, so somebody starts in there, and when should somebody start, by the way, with some of these laser treatments?
You know, we have patients coming in their early 20s, and these are the kind of patients who are just now starting to think about taking care of their skin. And so it's really, or they may have had acne when they were teenagers and now are suffering from acne scars. Is
earlier treatment better? Because you say you could stop. That means because you're rebuilding collagen. Is that right?
Absolutely. Earlier is always better. We're all aging, and so every day with sun damage and just intrinsic aging, we're breaking down collagen.
Okay.
When we do procedures like the photofacial, the Refirm, and Fraxel, what we're doing is we are rebuilding collagen. And so we can stop aging, we can even reverse aging.
Now we're going to have to put, I should mention too, I mean, you did not pay to be on this program. It's a real interview. You're not reading cue cards, but am I going to have to put disclaimers everywhere that say, because you're saying stop, yeah, but you're saying stop aging. I mean,
you can.
I mean, you feel that.
Absolutely.
The appearance of aging.
We have, well, yes.
Okay.
You know, this is a joke that I tell my patients, is that, you know, I may be losing my vision, I'm starting to get a little farsighted. The insides may be getting older, but the outside still looks pretty young.
Because, yeah, and I know your age, and I keep saying that you look a lot younger. Your husband too. You do treatments on each other.
Absolutely.
He's your
we take off maybe one day out of every month, and we do all of the treatments that we're going to talk about to each other. We're believers of this technology. We want to keep each other looking great. And it's possible now.
Let's talk about
why not.
your credentials. I mean, people, I guess, physicians travel all over the country to see you. You speak nationally, is that right? And internationally.
Right, right.
On what? On what topics?
I speak about skin rejuvenation. I speak about body sculpting. And so, you know, and then teach physicians. It's really all about educating them how to do this right, because there's really a right way and a wrong way. And also, on top of that, there's an art to doing this right, so that patients get amazing results each time. And
how much is art and how much is science? I mean, you have to have an eye
I would
for
say
it.
80% art. And then the rest is technology. Obviously, you have to have the right technology, specifically for if you're going to apply it on all skin types.
Okay.
But the rest of it is really how much do you know the skin, how much do you push the skin so that, you know, patients can get great results.
You have an advantage as a dermatologist?
Absolutely.
Because medical spas are everywhere now.
And that's true. We have the benefit, and my patients have the benefit of really, you know, having my expertise and our expertise in the clinic, that we know skin, we know how to treat it well, we know how to treat all skin types well, and we can guarantee them. I can look at them, you know, during consultation and say, I can guarantee you we can get great results.
Great results. Now, your husband works with you.
Yes.
And we should talk about your background and training. He went to Yale undergrad. You guys met at Stanford, is that right?
He's a smart guy, but he's the coolest, nicest guy you'll meet. And all my patients, all my patients really appreciate talking to him. He's a great listener. He's a great educator. He makes sure the patients' concerns are addressed and that their questions are answered, and he takes the time to do it.
So what made you want to get involved in cosmetic dermatology?
It's always been an interest of mine from the beginning, even before all of this lasers and all this technology came out. I'm just interested in aesthetics. And I think that's the artist side of me coming out, is that I love beauty. I can see it, I can imagine it in my head. And so when I look at my patients, that's kind of how I look at it. I can kind of envision what we can achieve, and a lot of it is art. And I think it just matches my personality. And then the other side of my job, which I love the most, is that not only am I transforming the outside, because we do amazing, you know, external transformation, but what it can do for patients.
You say it raises their self-esteem for some people.
Absolutely, and that's, you know, my 20-year-old acne patients who we clear their skin, they become more confident. The moms who are so busy taking care of their kids now are finally taking care of themselves, make them feel sexier, you know? Yeah. And then we have the patients in there who are baby boomers who feel great, but when they look at themselves in the mirror, they look, you know, they feel depressed. Yeah. So we're matching it, and patients' lives are changing.
I mean, you are getting a lot of notoriety. You are featured on the Rachel Ray Show. Did you do a treatment on Rachel Ray on camera?
I did it live on camera, and you know, she wasn't numb or anything. And you know, Rachel Ray, she's just so bubbly and everything. But we did do her treatments, and that's the other thing, is that these types of treatments, celebrities love them for a reason.
Why?
And we did a treatment called Refirm on her, and no downtime type of procedure, and it just remodels the skin. It builds new collagen and improves your under eye area, your cheek fat pad, improves jowling, the neck, the hands. It's just fantastic, and the beauty of it is there's no downtime. So celebrities love it.
Okay, let's talk about the technology you have. I mean, if you had to say, okay, this is what's new that's great for skin, what is it?
It's really ELOS. ELOS is electro-optical synergy, which all of our devices are really based on. And this is combination of light and laser with radio frequency.
Okay.
There's a lot of science behind it, but basically it all boils down to results. It allows me to really deliver patients the safest and most amazing results, and we can now do these types of treatments.
So even wrinkles on the skin?
Absolutely,
but
wrinkles.
But the part I don't
brown spots, rosacea.
Is if you're not peeling the skin, how are you getting rid of the wrinkles?
You know, the beauty of technology is so smart, because all of that target, the pigment, the broken capillaries, hair, it's all underneath the skin. So we have to get our energy underneath the skin to make it work. But now we're keeping...
So it fills in the lines?
It fills in the lines by creating collagen.
Okay.
It targets the pigment underneath the skin, but you're not peeling because we're keeping the top layer of the skin completely intact and safe. So that's why it's safe for all skin types. Even someone who have, you know, chronically tanned like me can now get treatments without any problem with this technology.
When we first met, I was, because I had an IPL treatment before, and you were telling me about this, this new technology. You said that years ago you couldn't really do IPL because of your skin.
I've never even tried the regular IPL
Why?
treatments, because there was a lot of risk with the traditional old lasers plus intense pulse light IPL devices on my skin or patients with skin of color. But with ELOS, we don't have the same kind of possible problems, and it was designed to be safer for all skin types.
It thinned out your lower face, you say?
This is
because you look different.
Right.
I mean, I had you on the show, I think, 10 years ago, 9 years ago.
Right, and I have patients who see me month after month and 6 months later, and they're like, wow, you look younger
now. You are
now.
getting younger.
Yes.
That's right.
And it's so funny, Randy. We filmed a segment about a year ago,
yeah.
And I have patients who've seen me recently who said, you look older in that show than you do now. And that's what's happening.
Do you believe that? That's not just lip service, that you are getting younger?
I
visually?
am looking younger visually, absolutely.
Are you kind of excited, too, about what the future is going to hold? That means that you at 50...
Absolutely. You know, when I lecture, and I give lectures all over the world, and people can't sometimes believe that, you know, that I'm this doctor because I look so young.
Yeah.
And I tell them, you know, my goal is I come back here in the same conference next year and I'll look even younger. It's possible.
What about cost? I mean, is it significantly more to go to a specialist?
No, I mean, it really isn't. And that's probably something that shocks patients. And they're pleasantly surprised to learn that, you know, they come to me, sure, initially it looks like it would be more, but the value that they get, because we can achieve results with one treatment that probably will require multiple series of treatments if they go to a medical spa and a technician, not even a doctor, is doing their treatments. Unfortunately, I have many patients who've come to me who have wasted money because they've paid and they didn't get results.
Does that frustrate you, by the way? Gives a bad name for the technology?
Absolutely. I mean, this is why I go around the world trying to lecture and educate other physicians and practitioners how to do this right and how to do it well. Because, you know, it gives the whole industry a bad name, or the technology a bad name, when a practitioner who's not properly trained, you know, delivers poor results or creates complications for patients. Whenever I give lectures and I show my before and afters, other doctors come up to me and say, you know, I don't get those kind of results. What are you doing? There is a right way to do it.
Is there a big learning curve, by the way?
Absolutely, absolutely. Okay. And I do all of my treatments. We do, you know, physicians do treatments in my center. So I have gained experience above and beyond what most doctors do.
Okay, we're learning about technology today. ELOS, something you want to ask your doctor about. What's another? Fraxel?
Fraxel is amazing, especially on my Caucasian patients when you're starting to see wrinkles that you don't like, especially around the eyes. And Randy.
Yes, okay. I think I know where you're going.
You're looking great. Who's your dermatologist?
All right. It's you, it's you.
And, you know, you came to me and you're like, oh, I don't like that, you know, crepiness and lines around there.
I didn't quite say it like that.
I know, but I said the crepiness, and that's one of my favorite words, you can tell. But this is one.
You said, I mean, one treatment. I had one treatment. You said the only thing that wasn't exactly right, you said about 5 days downtime. The next day I'm at work, not a problem. But people compliment me now on my skin.
And I take credit for that. No,
I tell them. Yeah.
And it's amazing what we can achieve with one treatment if it's done right. And this is wonderful for patients who are starting to have saggy upper lid area, the skin there, and they're considering maybe a surgical procedure, but they're scared somehow. And the Fraxel is wonderful in tightening the skin there, improving lines.
It tightened up my neck.
And we did your neck too.
This was one treatment.
Right.
How many more am I going to need?
Oh, however many you like.
What do you think? What do you think? I mean,
you know, I would say that the more you do, the better. Most patients after 4, they're dramatically better. They look
you say this about yourself,
better.
that in the next 10 years you're not going to probably age. Do you think that if I see you consistently, I'll stay this age for the next 10, 15 years?
I promise you.
Okay. Even younger?
Younger, yes.
Younger. So I'll look younger in 10 years than I do now.
Technology is only getting better, and when you combine these types of laser procedures with a little Botox, a little fillers for, you know, nasolabial fold, Botox for around your eyes and forehead, it's fantastic what we can achieve now.
So you do a lot of Botox?
Absolutely.
Is there a technique with Botox? Seems pretty straightforward.
There is an art. You cannot. The biggest problem is that you cannot cookie cutter treatment. You can't do that kind of treatment. Every face is different. Every muscle, I mean, you have to really, men and women have to be treated differently with Botox. The units, how you're diluting it. Some doctors who are charging so little are really not delivering the right number of units.
So diluted Botox?
Absolutely.
But you'll never know. I mean, how does a patient know?
Well, it's not going to work. So then you think Botox doesn't work, but it works beautifully if it actually, you know, if they're delivering the right amount of units. Number 2, it doesn't last as long as it should.
Okay.
So there's a lot of things, a lot of education that needs to be done for the consumers out there.
Okay, we're going to take another break, and we're bringing on one of your patients. Carol Ann Mance. Tell us about Carol Ann.
Carol Ann is a typical patient who's in her 40s, early 40s, and are now just starting to kind of look in the mirror and say, boy, I'm starting to see signs of aging on my skin.
She doesn't look 40, by the way. Saw her in the green room.
She's had a treatment. She's had one treatment, and she's gorgeous to begin with. I have a lot of gorgeous patients who who are still bothered by lines around their eyes, fine lines around their mouth, large pores, sun damage, redness, discoloration on their face, neck, and chest, and hands. Lots of things can be done now, and Carol Ann, she'll tell you her story.
And you have a lot of just everyday folks. I mean, people that I guess wouldn't have gone to do anything before 10 years ago, men, women, everybody.
After the Rachel Ray show, where I did Reform on Rachel Ray, women came to me and said, I never thought that technology was possible. I thought with my sagging jowls, and lines, I'm going to need plastic surgery, and they are so blown away by what our technology can do now. They're so happy. All
right, okay, we're going to come back and we'll meet one of your patients. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, one of Dr. Mauricio's patients that's had, what did she have again?
She's had Fraxel and photofacial.
All right, we'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in facial rejuvenation? With us we have San Diego's hottest dermatologist, Dr. Tess Mauricio, and we have one of her patients here, Carol Ann Mance. Carol Ann, thanks for coming on the program.
Thank you.
Now, how did you hear about Dr. Mauricio?
Well, I actually heard about her through my friends. In addition, I actually saw her on TV, and she's known as the San Diego's hottest dermatologist.
That's right.
And a few months ago, I kind of made a decision that I'm turning the big 4-0.
Well, you're 40 already, according to this.
I am 40.
And you look a lot younger than your age.
I am 40, and I kind of wanted to kind of enhance my skin.
Now, you said before the break that she represents a typical patient.
Absolutely.
You turn 40.
40 plus, fair skin, who basically she's now starting to see the signs of sun damage on her skin, and that as the pigmentation. She was complaining about a lot of discoloration on her face, on her neck, a lot of redness on the neck and the chest, that it's really affecting the way her confidence in actually, wearing some of the outfits. Right. And then also she's complaining about crepiness around her eyes.
You call it crepiness. Exactly, define crepiness.
Crepiness is basically as the skin loses elasticity and it gets thin. And then also, as we all age, what happens is their muscles around the eyes become stronger. And so it bunches up that thinner skin, and then you start creating lines. And it's a hard area because you're piling on makeup to try to get it better, and then
so you had
looks
Fraxel.
Worse.
Is that right?
I had Fraxel.
Did it hurt? By the way, does it hurt? Did
no,
it hurt you?
It did not hurt. It just feels like you have a very intense sunburn. But I went into Dr. Mauricio's office, got a little numbing cream on my face, relaxed, good music.
How was it there, by the way?
Very pleasant. I actually fell asleep. So I laid on the table there, got the numbing treatment, and about half an hour later, Dr. Mauricio came in and kind of went ahead and had the laser all over my face.
So it doesn't hurt during the treatment?
No, it does not.
Okay.
You feel a little tingling, but very slight, very slight.
Do people compliment you about your skin?
Oh, absolutely.
So Caroline, are you excited about the next treatment?
Oh, absolutely. I mean, I can't wait to get my next treatment done. In addition, I told all my girlfriends.
So what's next for her?
Well, she's only had one treatment, so we're going to continue the Fraxel series, which I think will just be amazing for the lines around her eyes. And then we're going to continue to also do that for the rest of her face, because like she mentioned, it improves her pore size, texture. She also gets an overall kind of improvement in the way your makeup looks, which my patients love, that their makeup is going on better. And then more photofacial for her neck, her chest, maybe a little bit of Botox around the eyes. And then also,
she said her Botox is wearing off.
Yes, it's about time. She'll be coming in for her Fraxel and her other treatments. And then she's also now starting to take a look at her hands, because the hands is probably the next frontier in rejuvenation, because we have many women like Carol Ann who have the wonderful outfits, but are really trying to minimize to wear jewelry on their hands, or because they can't show it. And
is this more about maintenance for her? I mean, how do you look at this? Because she already has great skin, looks good. So
well, how to look at it is that we are all, all of us are all aging. And so what we're doing is we are really reversing aging. And the beauty of it, to do these types of procedure when you're in your late 30s and maybe early 40s, is that if you do these types of procedure, you never will need any kind of invasive surgical procedures.
Are you convinced, Carol Ann, that this will slow the appearance of aging?
Oh yes, definitely.
Could you make her look this way for how many more years?
Oh, forever.
No, seriously.
It really can be done, and that is the biggest advantage of technology that we have now, is that if you do it early enough,
so at 50,
at 50, she can look this age. Absolutely.
So earlier treatment. Now, why did you pick Fraxel first rather than IPL or ELOS or?
We actually did a combination for her. We did a combination of the ELOS photofacial because she had a lot of underlying redness. And that's very common in patients with fair skin. Okay. But Fraxel for her was perfect because it's wonderful for the lines around the eyes. It's wonderful she had some fine lines starting to happen around the mouth as well. Textural changes that happens with aging, like enlarged pore size. Some of the makeup's just not going on better. And then we also did the same thing for her neck, and it's improved some of the lines there.
So Caroline, you say you don't wear a lot of makeup. Anyway.
No, not too much. I mean, I'm very active. Like Randy said, I work and I have a daughter. So getting Fraxel treatment for me is just fabulous, because I put just quick makeup on and out the door.
Now, downtime. Because not everybody could take a week off. I guess with Fraxel, what is the downtime?
Well, she'll tell you.
I didn't really have downtime. Honestly, 3 days of maybe a little bit more redness, and you don't really have to, you don't wear makeup, and you just put a lot of sunscreen on. And then within like the 4th day, I mean, your skin is already looking just
looks great,
incredible. So you're sold on Fraxel.
Oh, absolutely, but it continues. What's so great about this is next week and the week after, you just keep on seeing it.
Well, how could that be?
How could that be? Is when she's in my clinic, all we're doing is we're turning on the collagen making factory. Fraxel delivers heat underneath the skin, which turns on special cells to create collagen. But this process actually goes on for months. And so this is why, she's
sitting here, it sounds like an exaggeration sometimes. But really.
And that's what my patients, because I'll see them month after month for their series, and they will tell me that my skin looks better 2 weeks after the treatment, even a month later. And patients who wait about 6 months and do a maintenance Fraxel treatment will tell me they're looking better throughout the months that they're actually not getting treatments.
Okay, so Caroline, what is it that you want next?
Well, definitely, I need to have a few shots of Botox. Yeah. we already decided that. In addition to, there's some fine lines still that I want to go ahead and maybe fill and get a few more IPLs.
Right. I
and
think
Fraxel.
it'd be wonderful to do a little bit of a Juvederm, which is a filler. This is a common area, you know, around here.
Right.
Just to put a tiny bit, and again, she's beautiful to begin with. This will just take you a notch up, you know, a tiny little bit of Juvederm around the edges of the lips. She's a knockout anyways, but this will just make her feel like a knockout.
Yeah. You know, when you walk in the door, I mean, you know, you can't help but judge people. She walks in the door, skin's flawless.
She's stunning.
There is credibility there. You know, it looks like somebody. You know, there is a class difference when somebody has great skin. So good for you, Caroline. Anything that surprised you about the treatment that you didn't anticipate that happened?
Well, like going into this, we're all skeptical, and you're just wondering, is this really going to work for me? And I highly recommend it, and it's a very quick procedure, hardly any downtime.
Did it hurt during the procedure? I think I asked that, but
just very slightly. And like I said,
'cause I had the procedure, it didn't hurt me. I was wondering.
Right.
Yeah, your skin looks great too.
She likes my skin too.
Well, you know, right. That's right.
The good skin people.
Well, you know, that's the one thing. Even my most pain phobic patients can really get through the procedure, and they're totally fine. And we do everything in our clinic to make sure the patients are comfortable.
Okay.
But you know, when it's done well, when it's a person or you have an expert doing the procedure, you can get amazing results. And as you've seen with Caroline, even with a single treatment.
Well, Caroline, thanks for sharing your story with us.
Thank you for having me. It's been an honor. One last thing though before.
All right.
I do want to say that I met Dr. Mauricio's husband, and he's fantastic.
He works there in the office.
Yes,
okay.
Yes. In addition, Dr. Mauricio, in good hands. I mean, just great personality, makes you feel welcome, knows exactly what you need for, you know, your face and all your skincare needs. So just thank you so much.
Thank you, Caroline.
All right. Well, very nice. Very good. Thanks again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.